Includem is a charity that was set up 21 years ago by social workers who were considering young people that they felt had been failed by the system, and what, if they designed a service from the ground up, did it need to look like to meet those young people's needs. So 21 years ago, we were incredibly revolutionary in talking about the fact that young people weren't hard to reach, that it was services that were hard to reach. We talked about making sure that we met young people where they were at, rather than expecting young people to come to us. And we met them at times that they needed it, even if that meant it was 2 o'clock on a Saturday morning and they were in touch. Our practice has moved and changed, but those ethos, that core value, has stayed the same, which is that we need to be the ones who reach out to young people. We need to be the one who adjust and change and meet their needs. Initially, our client group were really high-risk young people, or what would have been deemed high-risk young people at the time, those who were at risk of involved in criminal justice, involved in conflict with the law, at risk of ending up with a sentence, at risk of coming into care or secure care. And again, over time, what we've recognised is that our model and our approach to working with young people, putting young people at the centre, young people being in charge of their own support plan, being in charge of what they do, works across the board, not just for those young people who are deemed high risk. So we've moved out and we provide now much more family-based support, and at all ends of the spectrum. So from a very early intervention phase around behaviour management for those families that are just starting to experience difficulties, right up to that higher end intensity. Still, we provide support around justice, we provide support around mental health, we provide support around additional support needs, particularly young autistic people who have difficult family situations, to try and create that support. We provide support for foster carers where there's a risk of breaking down. For example, the influence that we now have across that broad family support is quite significant. So that's the day-to-day work we do. Alongside of that, we're doing a lot of policy and influencing work. So recognising that the families that we work with are those who are less likely to have a voice. They're less likely to respond to consultations. They're less likely to speak to services about what's not working for them. For lots of the families we support, they've told us that years and years of being involved in statutory services, years and years of trying to influence their own support plans, have been unheard or unsuccessful. So they certainly don't feel able to do that broader influencing about policy. So we're working really, really hard to try and hear as much as we can from those young people and families, and to then amplify their voices into different spheres. And we're currently embarking on our most ambitious project yet, which is we've hired 3 people who were supported by Includem as young people themselves about 10 years ago as peer researchers, and they have devised and designed a research project and are now carrying out the interviews with the families we currently support to understand what it means to have multiple agencies involved in their life. What does it mean to be experiencing entrenched poverty, and how would they like services to support them best? So I think it's interesting. In 21 years, we haven't moved far from the values, but we've definitely moved a long way in terms of the influence and the ability to deliver what we deliver. As we've shifted and as we've moved and as we've understood that actually we have a responsibility to be amplifying the voices of the families we support, we really needed to consider how was best to do that. And I think as we've moved also away from traditional social work services and into the mental health field, and we're now delivering a service with the NHS in Glasgow, the multiple risk service, that integration between health and social care became more and more important to us. And I think at that point we started to look, how can we join up with like-minded organisations? How can we hear more about what other people are doing that we can potentially tap into? But also, how can we, when we're doing some of the things that we're most excited about, potentially connect with other organisations who are doing something similar, or join our voices in order to make that message even stronger. And I think that's what the Alliance gives for us in terms of us being able to learn a lot, but actually we had a lot to contribute as well. And I've just been really excited. We've only been members for a couple of months, but we've had some really interesting conversations already, and really keen to see what will happen from that.